Hello everyone, I am Dr. Tejashvi Borjalla, consultant doctor in Fidicus Homeopathy. Today we are going to discuss one of the confusing topic for every couple, that is unexplained infertility. In this video, we will mainly understand what it means, its causes, risk factors, and the investigations to identify these conditions and the treatment options available for this unexplained infertility. I can explain this clearly on the board. Let's move on to the board. Now let us understand what is unexplained infertility. It is a condition or situation in which couple are facing difficult to conceive despite of all the normal investigations are despite of all the fertility investigations are normal. This is a condition in which uterine cavity is normal, the tubes and also the endometrium all are looking normal. But couple is unable to conceive. It is usually diagnosed after 1 year of regular unprotected sexual intercourse without any pregnancy. This condition is usually seen in 10 to 12% of all the infertility couples. This is a condition in which couple are facing not only confusion but it can also cause emotional distress. But this condition can be identified with proper investigations and it can be treatable. Now coming to the hidden causes for this unexplained infertility. There are so many causes for this, but these are of minute in nature, like microscopic level of causes. One of the causes is subtle ovulation defects. It means there is small defects in the ovulation process. The egg may be released properly, but it lacking the maturing capacity. But sometimes when the egg is released, it is having with poor quality or poor DNA quality. So this egg can causes repeated miscarriages or unexplained infertility. Sperm functional abnormalities is the one of the cause, like abnormal sperms or any increase in DNA fragmentations in the sperm, are also sperms losing their capacity to penetrate the egg. Sometimes when the egg and sperm are normal, but the fertilization site may be difficult to conceive. It means any defects in the fallopian tube, or also the tubes looking open, but the problem inside the tubal environment, like lacking of any fluid in the tubal patency. All these conditions can cause unexplained infertility. Sometimes fertilization defects may be caused. In this egg and sperm are normal, fertilization may be happen. Fertilization defects in this egg and sperm are normal, but fertilization doesn't happen. Because the egg or the sperm don't have the capacity to penetrate. And in some cases, the fertilization happens, but endometrium lack the receptivity to take the growing embryo. It means there is small defect in the endometrium, but it is of minute in nature. This small receptivity loss also causes infertility issues. In some couples, there is hormonal imbalance. Even a slight hormonal imbalance of progesterone hormones, thyroid hormone, and other hormones like luteinizing hormone or TSH hormone, all these hormones can cause infertility conditions. Apart from this, some conditions like luteal phase defect. Luteal phase defect is the last phase of menstrual cycle. In this, progesterone hormone is essential in the continuation of pregnancy process. When there is any small disturbance in this luteal phase, also causes improper implantation that leads to infertility condition. In some tubal microenvironmental dysfunction, it means the tubes are remain open, but the tubal environment have lack the capacity to movement of the sperm or the egg. This it may be filled with some fluid or there any lacking of the fluid. All these conditions can cause the infertility condition. Apart from some genetic or immune factors may cause the infertility. Immune factors react with this egg or sperm like a foreign body and destroy the sperm. It results in infertility condition. And other factor is genetic factor. In genetic factor, DNA fragmentation may be happen. This causes the infertility issues. Apart from these hormonal, genetic, and immunological causes, some lifestyle factors may also cause the unexplained infertility. Lifestyle factors like improper maintenance of the sleep and diet habits, like increasing of body weight, alcohol habit, smoking habit, and also caffeine intake. All these conditions can increase the hormonal imbalance that can result in the improper implantation or the improper development of the embryo. It can lead to infertility condition. All these causes may be aggravated at the age above the 35 years. Usually in females after 35 years of age, the quality and the maturity capacity of the egg may be decreased. When fertilization happens in these conditions, it can lead to miscarriages or improper development of the embryo. And also some lifestyle factors also cause this unexplained infertility. So, nutritive factors, hormonal factors, ovulation factors, sperm factors, all these factors can cause the infertility. Now coming to the investigation necessary to diagnose the unexplained infertility. Usually the most common investigations done in fertility cases are: one is complete history and Physical examination. In this, the complete history of the menstrual cycle, sexual history, infection history, all this history may be taken by the doctor and also examine the patient clearly. After this, hormonal profile may be suggested. In this hormonal profile, any imbalance in the hormones like TSH hormone, prolactin hormone, progesterone hormone, and also luteinizing hormones should be evaluated. Apart from this, ovulation test may be done by using ultrasonography. In this ultrasound, any defects in the endometrium or any defects in uterine cavity should be identified. And also, follicular study should be done to identify the normal functioning of the follicles, like if the egg is released properly or not, should be examined by this follicular study. And also, AMH study. AMH study means anti-mullin hormone study. Next is semen analysis. In this semen analysis, the quality, count, and the motility of the sperm should be examined. Next, tubal patency. Tubal patency is examined by using HST. It means it is an X-ray technique in which dye is inserted into the uterine cavity. Through these dye passing, you can examine the uterine cavity and the tubes. And also some pelvic ultrasound should be advised. By doing all these ovulation study, follicular study, and also semen analysis, ultrasonography, and the hormonal study, in all these investigations, the reports would be normal. In spite of all these reports normal, the couple is difficult in facing conceiving. We called it as unexplained infertility. By this, we can diagnose the unexplained infertility condition. Now coming to the conventional treatment options available for this unexplained infertility condition. In this unexplained infertility condition, the conventional treatment mainly advises ovulation inducing drugs. It means by using ovulation drugs usually contain hormonal pills. These can induce the ovulation and it can also enhance the egg production. So the long-term uses of these ovulation-inducing drugs can also cause some side effects like hot flashes, which means a hot feeling over the body, and also weight gaining, headache, mood changes should be caused by this long-term use of these hormonal pills. Next, time intercourse. In spite of all using these medications and other procedures, timely intercourse is mandatory. Next is IUI. IUI means intrauterine insemination. In this, sperm is artificially inserted into the uterine cavity. It is a procedure. It takes a lot of time and also cost effective, but it can also side effects like repeated infections, and it is of cost effective. Next is IVF or ICSI. These are also nothing but artificial test tube baby. In these test tube baby procedures, the entire process may be done outside the uterine cavity, but it is also causing some side effects. Both these processes should not be done in single procedure. It will take some multiple attempts to conceiving. So these processes are also helpful in some couples, but not in all. But this is also causing some side effects like hormonal damage. It can also decrease the capacity of the female reproductive system to conceive, and it is of highly cost effective. Next is treating the underlying endometrial issues. In these conditions, some drugs may be advised. Treating the underlying endometrial conditions. In these conditions, medicines are advised to maintain the healthy endometrium. But it also causes some side effects like hormonal imbalance, weight gaining, mood changes, bloating sensation, and recurrent pain may be causing. So, conventional treatment mainly focusing on the presenting symptoms. It means it can mainly focus on the hormonal imbalance, but it doesn't focus on the root cause of the condition causing unexplained infertility. Now coming to the homeopathic treatment in case of unexplained infertility. By using these homeopathic medicines, we can improve our natural capacity. These medicines can stimulate our own body to conceive naturally. By taking these medicines, ovulation process may be speed up. It means it can enhance the ovulation process and it can also reduce the poor egg quality. By using these medicines also, you can increase the endometrial receptive capacity. Is there any infection should be controlled by these homeopathic medicines. By these homeopathic medicines, we can cure, prevent or relieve the unexplained infertility condition. Apart from these, homeopathic medicines are safe, effective and timely. Why it is safe means there is no side effects. It means zero side effects of using homeopathic medicines. These medicine doesn't contain any artificial hormone, so there is no side effects. And also effective treatment. These medicines act underlying root cause of the condition causing unexplained infertility. It can also focus on the minute causes that causing infertility. So by this, you can improve our conceiving capacity. And it can also cure timely treatment. When we advise homeopathic treatment timely, it can prevent the complications of infertility. So these are the advantages of selecting homeopathic medicine. If you are suffering from this unexplained infertility, Fidicus Homeopathy is the best option. What do you get from Fidicus Homeopathy means? The success of case mainly depends on the three main steps. One is the treating doctor, second one is the drug device we are following, third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, experience, competence, and compassion. The drug device we are following is of top quality medicines. We are getting our medicines from best pharmaceutical industries and we are also best in segment. The infrastructure we are using is of latest technology and artificial intelligence. By using this latest technology and artificial intelligence and treatment option, we can give better results to the patient. Now coming to the consultation part of Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. One is online consultation. Second one is in-person consultation. In online consultation, audio and video call options are available. By using these options, you can share your reports to us. If any reports are necessary, we will let you know. You can get it back locally and send it back to us. After completing the case, taking the main treatment will be started. Once the treatment is started, we will ship your medicines to your doorstep wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India, it will take 3 to 8 business working days. If you want to consult Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. Now coming to how to consult Fidicus Homeopathy. This is our WhatsApp number 7997101303. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. You can visit our website. By this website also you can get consultation. Why Fidicus Homeopathy only? There are so many corporate hospitals are there. So many homeopathic hospitals are there. Why Fidicus only means? Fidicus Homeopathy stands for highest chance of health. And also Fidicus Homeopathy mainly follows three main principles. One is the highest success rate. Second one is the transient treatment. Third one is the personal care. Regarding these infertility cases, we are having highest success rate. And we are also providing personal care. Personal care in the sense we can explain the condition to the patient clearly and also prognosis to the patient. We are also providing personal care. Homeopathy mainly based on the individualized treatment. So this we are providing each and unique treatment to every patient and we also advise them to maintain a healthy and balanced life. All these are the advantages of selecting Fidicus Homeopathy for your safe, healthy and happy life. Now we discussed about the what is unexplained infertility, its hidden causes and the risk factors, investigations and the treatment options available for this condition. Remember, this is the condition where all the reports of the possible pregnancy are normal, but pregnancy doesn't happen. If you are struggling with this unexplained infertility, Fidicus Homeopathy is here to help you with safe, effective, and timely treatment. Thanks for watching.